Go ahead, Lisa.
Okay, so, all right, here we go. So thank you so much, everyone, for joining us. This is our last presentation for the month of October. The month has flown by, and we are very lucky today to have Jackie from the Alzheimer's Family Organization speaking to us about the do's and the don'ts of managing dementia behavior. But before we start, I want to tell you about a couple events that we've got coming up. My name is Lisa Honka, and I have a company called Your Key to Senior Living Options. I help seniors find resources in the area such as independent living, assisted living, memory care community that matches their care needs and also financial needs and wish lists. But I also find resources in the home such as home care or if someone's looking at daycare opportunities or perhaps down the road hospice information, I can certainly be a resource for that. And my services are free. So we'll go on to the next slide, please. So upcoming, we have some events coming up through TLC, which is Transitional Life Counselors, and they're talking about the Unleashing the Power of Your Mind, and that's going to be on November 5th. We're going to have Susan Richardson from Clear Captions discussing how you could get a free phone through the phone service through Clear Captions. So if you have some hearing impairment, this is a free phone that you can get that you can actually read the information instead of hear, and she's going to teach us about what services the Clear Caption provides either on your cell phone or your home phone, and that's going to be on November 12th. And then we are going to be doing a caregiver, savvy caregiver training in January. And that will be a free training. It is limited to 20 participants, and you have to sign up for that. And that will be, again, on our website if anybody's interested in more information about that. And then we're really excited about Teepa Snow doing a presentation for us, and that's going to be January 28th and February 25th. She is going to be doing a Zoom call with us, and again, that's free. She's world renowned, and people travel miles and miles to see her, and you'll be able to see her in your own home. She is really like an Energizer bunny. She's got lots of resources, information. She's been doing this for a very long time, and I think you're going to learn a lot. And again, that service, that information is on our website, and it is free. There is just registration required for that. All of our events are at Your Key to Senior Living Options on our events page. So please go to that. And if you're interested in these upcoming events, sign up. Go ahead to the next slide, please. So right now, Jackie, it would be great if you tell us a little bit about you, the Alzheimer's Family Organization, and then go ahead and start with your presentation. We're so lucky to have you. Thanks for joining us today.
Thank you for having me. I hope everybody is comfortable and seated and has a cup of coffee, and we're ready to share this morning, and I hope that it will be beneficial to you. As Lisa said, my name is Jackie Kuhn, and I work for the Alzheimer's Family Organization. And this is a very small, not-for-profit organization. We cover 8 counties. I am what they call a community educator, and I cover the villages, Sumter, Lady Lake, and Marion County. As far as offering speaking on Alzheimer's, giving families information about what to look for, how to deal and work with some of this journey that they're on. And so it's a very hands-on organization. We survive by fundraisers, and with that fundraising utilizes the information that we provide to you. And again, as Lisa is, what we do for the AFO is free. And so it allows us to really get involved in many areas. So it's an organization that the family stands for the caregiver. Our focus is the caregiver because we feel like the caregiver is the one that remembers the journey. The loved one with the diagnosis does not. And we know the caregiver is a very vital part of the survival of their loved one, as well as the survival of their self. in traveling down this journey. So as we talk today, we're going to be talking about the do's and don'ts of managing dementia behavior. And you're going to hear some repetitiveness because I think it's very important that as we go through these slides and as we go through this presentation, that there is a great understanding of what your role can be. And if we choose to take a different role, how difficult the journey may be. And so it's sometimes hard to do, it's sometimes easy to do. But we know that, again, the information we're providing is something that we feel is very important to assist the caregiver as they care for their loved one and as they prepare for this journey that could be 1 year, could be 20 years. And so we hope that you're able to get something from today's presentation. So we're going to start with the do's and don'ts. First slide, please. All right. You know, we talk about the journey as finding a new way to communicate. We're trying to think outside the box as we work with our loved one. And the one thing that I tell my families, if I can instill upon you, is that never argue, instead agree. And I want to share with you why that is so important. If I tell my families, if you walk away from today's program with one thing, it is that we have to step outside our comfort zone. We have to step out of that world of reality and step into that world of validating where our loved one is. And sometimes that's so difficult because we see our loved one as this adult and they should be at the same place we are. And they should have knowledge of who they are and what they were. But instead, we see them going back to a time in their life that could have been in their 20s, 30s. The one time in their life that stands out is where they are. So when we talk about never to argue, have you ever had that friend who, no matter what kind of conversation you're in, but you're debating and nobody wins from that, and you walk away very exhausted and tired of thinking, you know, what else could have I said or done that would have made them understand my point of view? Well, when we're working with our loved one with Alzheimer's, it's like if they are in a position of being in their 20s, they're not going to be where you are today. As an example, I have a family whose husband says every day, when are we going home? And she repeatedly says, we are home. And then he says, this is not my home. So he may be focused on the home that he grew up in, or the home that you first had when you first got married, but he doesn't see your present home as home, yet you know it is. And so we try to rationalize with him, and we try to say, you know, this is your home. We no longer own that home. We haven't been in that home for 30 years. This is now your home. He does not agree with that. He still says, this is not my home. I want to go home. So instead of putting ourselves where we want them to be, we need to put ourselves in the position of where they are. So here again, we're stepping out of that world of my reality as the caregiver into that world of validating where my loved one is at that very moment. So if you've had that friend or you've had that loved one that you've just never been able to win an argument, this isn't the time to try to win an argument. This is a time where you have to step out of that world of reality and step into that world of agreeing with where he's at. As an example, I had a resident who was when she was younger, had twins. And she was sitting in our memory care one day. And so I asked her, I says, Betty, what are you weeping about? She was crying and she was holding both of our dolls in her hands. And she says, my babies are sick. My babies are sick. They need to see a doctor. Reality was, if I were to say, Betty, you're 80 years old. Your twins are grown and gone, and you are holding dolls. Well, that would have only set her off because she was adamantly in her world of when she was a young mom. So instead I said, well, Betty, give me a moment and let me see if I can call the doctor. So I go and get my physical therapist. I put a white jacket on him. I put a stethoscope around his neck. And I say, now you're Dr. Kuhn. So I took Dr. Kuhn in to see Betty. And I said, Betty, this is Dr. Kuhn, and he's here to examine your babies. So Dr. Kuhn took each child, stepped away, examined them, brought them back to her and said, Betty, your instincts are right on, but your babies are going to be fine. And the weeping stopped and she relaxed. And it was like, oh, thank you. That took a matter of 5 minutes versus us arguing with her about where she was at that moment. Another great opportunity is that many times children like to make sure mom and dad are corrected and that they try to bring back that memory. We had a daughter one time was visiting with her mom, and her mom said, well, dad's coming to dinner with us tonight. And the daughter says, Mom, dad's been dead for 20 years. He's not coming to supper. And all of a sudden her face dropped. She began to cry and she goes, he's gone? I didn't know that. And she began the grieving process all over again. Versus if our conversation would have been, Mom, let's go sit at the table and wait for dad. The staff will bring him to the table when he gets here. They go to the table, and within a matter of 5 minutes, the mom has completely forgotten about dad coming to dinner. It not only saved a lot of argument and frustration for the daughter, but it also saved the mother from going through another grieving process, and the fact that we validated where she was. And so sometimes that's very hard for us to do as caregivers, is to validate. But we have to learn to step out of that box of reality and step into that box of where my loved one is at this time. Many times that's the reason you'll go into a memory care unit and they may have a memory care box right there by their door. And it's not a picture of who they are today. It's a picture of who they were 20 years ago, 50 years ago, in the prime of their life. What is the time of era are they talking about the most? So maybe I was a dancer in my younger years and it's a picture of me in my dance costume and I'm dancing. Or if I was a fireman, it's a picture of me in my uniform back in my 30s. Those are what they recognize. Those are what they look at to say, that's who I am. One of the most noted phone calls to the police or sheriff's department is that somebody may say, there's someone in my home. I don't know them. Please come. And so the police come and they do a complete sweep of the house. And unbeknown to them, nobody's there. But when they're walking out the door and there's a mirror there in front of that entrance, and she walks by that mirror and she'll stop and say, there they are. That's them. That's the person that's in my home. And it's because they don't recognize themselves at 80 years of age. They only see themselves in their 20s or their 30s. So therefore, they think somebody is in their home. And so it becomes very daunting for them to realize that, that's them. And so the police have to help them understand, or I would say remove the mirror, but it's important again that they understand that it's a part of this process, a part of this journey that they're going on. And again, it's stepping out of that box and stepping into that box of validating where they are. Second slide, please. Never reason, instead divert. And it's kind of going back to what we just were sharing. You know, we don't want to sit there and try to reason with them. Their thought process is not what it was 5 years ago, 10 years ago, 20 years ago, as you remember. But instead, they are now fixated on a certain time in their life. So sometimes we have to become creative. Instead of trying to reason with them, we're trying to find a way to divert them, trying to redirect them, as we had kind of shared. An example for this is I had a resident that always every morning would say, I'm going to miss the bus. I'm going to miss the bus. And reality again would have been to say, you know, June, you're too old for school. You're 80 years of age. You no longer go to school. There is no bus coming. But again, I'm going to divert her. And I'm going to say, you know, I'm going to sit here and wait with you until that bus comes. So we make sure that you are not late for school. And within minutes, we're able to say, well, let's go for a walk. We have diverted them from where they were to another time and place. And many times, as you already know, if you're a caregiver, their attention span can be very short. So it's very important that we find things that we know works for us and we reuse them until they don't work, and then we become creative again and finding another way to divert them, to distract them from what they're thinking. And so we don't want to force the issue of trying to reason with them, because again, the thought process is not there. And they're not going to be able to understand when you try to walk them through a process of trying to understand and reason with them, because it's not going to go anywhere. It's not going to end up where you want it to end up, per se. So it's very important that we learn the ways that work for us. Everybody is different. Everybody's journey is different. So what works for us for a diversion? I had a family member call me one time ago. My mom wants to go get groceries every day. And we were taking her every day. And every day we'd come home with the exact same things. We have a pantry of multiple things that are repetitive. And so that became very daunting for the family. So I suggested that maybe fill a grocery bag like you were just at the grocery store. And when mom says we're going to the grocery store, we can go get that grocery bag and say, Mom, we just got back from that. We've already have our groceries. So that way it would appease mom. And we diverted to taking a different strategy on how we can help her not have to go to the grocery store every day. But if she wants to go every day, we already have the groceries intact. So again, we don't want to try to reason with them, because the only person that's going to get frustrated is you. It's not going to be the loved one with the diagnosis. You're going to be frustrated because you're trying to help them and convince them of something you know is reality, but instead we have to validate where they are. Next slide. Okay, we don't want to shame them and make them feel like they're doing something wrong either. You know, it's so easy to say, Mom, I can't believe you don't understand what we're talking about. You know, or to say, I don't know where you're at. You've got to understand what I'm trying to say. And that can't happen, because again, that thought process is not functioning. And you know as well as I do as a caregiver that it can become very repetitive. It can become very consistent and very daunting for the caregiver to constantly About the 10th time they ask the question why, you're becoming very frustrated because you're having to say the same thing over and over. So we have to, again, find ways to distract them, divert them, but we don't want to shame them. Sometimes on this journey, when there's an early diagnosis, the loved one with the diagnosis understands what is going to happen to them. They understand they're going to lose their memory. They understand that life is not going to be the same, but yet they do not have any control on making that change. They have no control on the thought process and what is happening in the brain. So it's very important, again, that we want to make sure they keep that dignity, that ability to be that person that you've always known as, but at this time, they do not have the thought process they had back then. We talk about never shaming them. I had a loved one tell me one time that they wanted to get their mom or their wife or dad a name badge that says, my name is, and also that I have Alzheimer's. And I said, do you think that really is a wise idea? And they said, well, I want people to know that if they approach her and she doesn't respond the right way, that she has this diagnosis. And I said, when are you going to have a name badge on yourself and say, my name is such and such, and I have diabetes, or I have a heart condition, or are you going to put all your diagnoses on your name badge? So we don't want to shame them and make them feel like they're different. We want to keep things as normal as possible. I told this family member, I said, first of all, it's a real safety issue if you buy a name badge and indicate that they have this diagnosis, because it makes them an easy prey to say, hey, I can snatch her purse. She doesn't remember who I am. She can't tell anybody what I look like. Or does somebody maybe follow them home and say, they're not going to know or be able to identify me if I should decide to do something or rob their home or etc. So I said, we don't want to label them, just as we don't want to be labeled. We don't want to label our loved ones so that people look at them differently or maybe act differently around them. So we don't want to shame them with this diagnosis. We, again, want to be thinking outside the box to be able to distract them or to divert them. Next slide. One thing that's very difficult, particularly for the caregiver, is to not lecture their loved one. Because here again, we're seeing this adult person across the table and we're saying, I can't believe you don't understand what I'm saying. I can't believe that you're not recollecting what I'm trying to say. We've had this conversation before, but they don't recall. They don't and can't go back to where you've had this conversation before. So as I shared earlier, if you have that loved one who's being constantly repetitive, my voice begins to escalate every time I respond, to the point of 10 to 15 times later, I'm really frustrated. And then we change our tone of voice. And the one thing we have to be careful of with our tone of voice is that a loved one with the diagnosis, and they may not even know you're upset, but they hear it in your tone of voice. They hear it in how we say things. So we have to be very careful in how we respond, because ultimately they will respond in the same way you do. So if you begin to raise your voice and it gets louder and sounds like yelling, they're probably going to respond the same way and yell back. And that has done nothing but, again, frustrate the caregiver, frustrate the loved one with the diagnosis, to the point that, how do I get out of this? Again, we have to try to find a way to redirect or divert them. We want to reassure them that, what we're saying is we understand that they're not understanding, but reassuring them again where they are. Remember, stepping out of that box of my reality as a caregiver, stepping into that box of validating my loved one where they are. And sometimes for the caregiver, they begin to think, well, I'm not sure which world I'm in because I keep forgetting, what I'm supposed to do. So it becomes very frustrating. But sometimes we just have to be in that world of validating where they're at all day long. And it can be exhausting. It can be exhausting because you're thinking, well, where is he now? Or where is she now? But we have to begin, and as we know our loved ones, we kind of know where they're headed. And it's very hard to take that stand. I have families that I work with that just say, I get so tired of this. But unfortunately, it is what it is. And the loved one's brain is not going to change to the point that you can reason with them. You can try to help them understand. So we want to make sure our tone of voice when we're talking with them isn't a lecture tone, but instead it's a reassuring tone. Next slide. The one thing that is very difficult for our loved ones with the diagnosis is using the word remember. And why is that so hard? It's because they're fighting to try to remember. If we say, do you remember this? And then all of a sudden they're thinking, I should remember this, but I don't remember this. So instead, maybe we're starting to reminisce. Go to the place they are. Maybe they're at that time in their life when your children were young. That's the time to talk about those days because that's what he can or she can speak of. But when somebody says remember, it can become very frustrating. It's very frustrating for me. If somebody comes up and talks to me on the street and I'm carrying on a conversation and they walk away, and then I look at my husband or my friend and say, who was that? What was their name? And we can't recall their name. So it becomes very frustrating to us on a daily basis when somebody asks us to remember something. I'm a Post-it note queen because I put things on Post-it notes all over the place. And if I can remember where I put the notes, I'm in good shape. But the bottom line is we need to find a way to reminisce with them and not encourage them to remember. I had a daughter share with me one time that she went to visit her dad and she thought she was being kind of proactive. And she goes, well, Dad, show me your room. Take me to your room. So he starts walking down the hallway. And if you've been in a memory care or a facility, a lot of the doors look alike. And unless you've got it somehow labeled with a memory care box or something to know that that's your room. And he walked up and down the halls twice. And he says, I don't know where my room is. And that was very frustrating for him because he wanted to do something his daughter wanted him to do, but he could not remember. And so we need to encourage not using that word remember and forcing them to kind of go back into their shell, but instead let's reminisce about this. Maybe you've got old photos that you can pull out and you can talk about those photos and you can share those photos and be able to reminisce about those times in your life. And it's a good opportunity to kind of sharpen their brain and to also allow them to go back into a happy time in your life with those photos. Next slide. Never say I told you. Instead, repeat. I tell you, what's the one word you hated to hear as a child? No. Nobody liked to hear the word no, or I told you, or don't do that. Those are words that have some force. And so we want to be very careful in our verbiage as we talk to them that we don't say those, because that kind of puts them back again wherever they are, in a fighting mode to say, you never told me that. Don't tell me no. So it's very important that we choose our verbiage. Instead, maybe repeat what you wanted to say, or you want to regroup and say it a different way. But we want to make sure that we choose our words wisely. Raising even your children, that if there were certain terminologies that you used, it really flared up the conversation. And so we want to make sure in caring for our loved one, again, we're stepping out of that box of reality and validating where they are and thinking, how would they perceive this terminology? What would they do? And I know as we become frustrated, it's very easy to change our verbiage and change our tone of voice, which again only escalates more for the caregiver than it does for the loved one with the diagnosis. You as the caregiver are the ones that are upset, angry, and your loved one will forget about the conversation within a matter of minutes, but you don't. And so that eats at you. And so it's very important as the caregiver that you choose your words wisely and try to rearrange them so that you're either repeating something and regrouping rather than saying, I told you so, or using the word no, or don't do that, because those are words, again, that bring up feelings because they are forceful terminologies. And so we want to be very careful in how we choose our words. Next slide. As we were talking about words, one thing that we always say is you can't do that. Don't do that. No, you can't do that. Again, that sets a tone for where the conversation's going to go. Instead, maybe let's do this together, or let's try it this way. Maybe it might be easier. And again, it all boils down to the tone in which we say it. It boils down to the demeanor. Am I right in their face doing this, or am I standing back doing this? Am I giving them their space? So it's very important with our terminology, again, to be able to say, let's do this together versus you can't do that. Because that's normal terminology, which is easy to say and easy to come out as we're frustrated. So be sure that you're looking again at your words, your terminologies, the no's, the can'ts, stop. Those are all words, again, that are becoming very demanding. And so we want to make sure that we're looking at how we're saying things to our loved one. Next slide. We talk about never command and demand, instead ask or model. Many times, when we're asking them to do something, again, thinking of my husband or wife at a time where they would have understood, is to never command or demand, because we know that takes a tone different in your voice. Instead, ask or model what you want them to do. We would have our staff sit at the table with our loved ones with the diagnosis, because if they forget how to use their utensils, but if they see somebody else using those utensils in a certain way, they begin to follow. They begin to mimic your behavior and do the same thing. So rather than demand and command that they do something, maybe we're instead asking them to show us or to model it. How many times have you been, if you have little ones visiting and maybe their language still is kind of blurred and it's hard to figure out words, but you would say, show me. And they're able to get up and show you exactly what they want. So sometimes, many times with this diagnosis, it's easier for us to say, show me what you want. Show me where you want to go, so that you're able to know what he's thinking, rather than say demand or command them to do something. You're on their level of validating where they're at. So it's very important. Again, it all goes back to this tone of voice, to this conversation that we're trying to have. And they may yell at you and they may speak unkindly to you, but we have to, again, remember this isn't the person 20 years ago. This is a person today, and I have to validate where they're at. Next slide. I think the one thing as we become frustrated as caregivers is that we want to make sure we never condescend them. Instead, encourage them and praise them. If it's the littlest thing they do, we want to say, great job. We don't want to belittle them. And again, as a caregiver, when you're living in it 24 hours a day and you're being repetitive 16 times, it's hard to not say things that you would not normally say. And so it's important as we look at that to understand that we want to encourage them and praise them. And they may not remember what you said, but you do. And that's why it's important as you do these communication skills with them that you're able to watch the tone of voice, watch what you're saying and the words that we choose, and again, continue to always encourage them and praise them. And that not only gives an encouragement to your loved one, but it also makes you feel good. Next slide. Never force, but reinforce. Here again, you can't drag them to the dinner table. You can't drag them to the restroom. You know, we don't want to force them to do something they're not willing to do. Because here again, nobody gets frustrated except you as the caregiver. Nobody understands, and they don't understand what you're wanting. But if we force them to do something, then it becomes a battle that you can't win. You know, I tell my families, pick your battles, because some of them just aren't worth the fight. They're not worth the frustration of yourself as the caregiver to think, now I have to deal with this 24/7. So we want to make sure again that, you know, let's reinforce where they're at. Let's go where they're at. If it takes them 2 hours to eat supper, then it takes them 2 hours to eat supper. But we can't force them to do something that they do not want to do. And along with these slides, you know, I'm going to talk a little bit about, you know, when we talk about the behaviors, which we've already shared some examples of, but, you know, when you're talking with your loved one, make that eye contact with them. Make sure that you've got a visual on them and they're able to see you. You can't approach them from the back because they have peripheral vision. They have vision that's just straight forward. So if you approach them from either side or the back, you might get whacked. So it's very important as we look at that to know that these are all things that we can do with the slides that we've shown today in the way that we communicate with them. So stay in front of them, make that eye contact, and get down to their level. Don't stand over them, but if you have to bend your knees, if you have to sit in a chair, then that's what we need to do to better approach them. Approach them slowly and gently. We don't want to abruptly say something or do something that will be frustrating to them or scare them. So it's important as we look at the things that we talked about today, not only with our tone of voice, but it's our way that we approach them. Sometimes we have too much stimulation going on in the house and we have to tone some of that down. It's very important to what you're watching on TV. Is it appropriate for them to watch? If it's a war scene, does that bring back memories to back when they were in their 20s? If there's a hurricane or if there's something going on that can be very frustrating, it's very difficult. Many people love the History Channel. They do not recognize history to what is happening today. So you may see on history bombs falling, They think it's happening today. So we got to be careful with what surroundings are we putting our home in, and watching that stimulation. Always identify yourself. Everybody says, well, they should know who I am. They don't always know who you are. So, always give them your first name or say, I'm your wife. And many times if you say I'm your wife, they'll say back to you, no, you're not. You're not my wife. So maybe utilizing your name, he would recognize. And so we have to be careful. We have to find out that balance for each of us, what works in our home. But make sure that you're identifying yourself in some way, calling them by name. I know we use a lot of endearing names, but it's very important that we call them by their name. We want them to remember their name as long as possible. Touch them, hug them, give them that loving feeling. Again, this isn't stepping out of a reality box. This is validating, because that love is still there. And we talked about being positive. We talked about reminiscing. Use music. Music's a universal softness and a calmness for many people who might not be able to. They're a little restless. Music, their favorite music. Try headphones. Putting music on during the day or when they're taking a nap. Some of those things can just be very calming for behaviors. We talked about eating arrangements, one plate, one utensil. Maybe finger foods are necessary because they're no longer able to use utensils. But it's important, again, that we're making and simplifying their life. Be patient. We've talked about that. Be considerate. Stay with old memories and songs. We've talked about that, reminiscing and going back to that. That's a calming. To bring them to reality today may be very frustrating for them. And again, that's a battle the caregiver takes away, but the loved one with the diagnosis does not. Communicate slowly and distinctly. Sometimes when we get frustrated, we start to talk too fast. And that's why it's important that, again, all of this works into our tone of voice, our actions, our demeanor, and how we approach them. Communicate one thing at a time, repeat it in the exact same way. If I ask somebody to do something and they don't understand, I encourage families to repeat it the same way. So now they aren't thinking, well, you asked me something before, now you're asking me something different. I've got two questions to ask versus one. Simplifying things. I tell families, don't open the closet and say, what do you want to wear today? Instead, say, you pick out two outfits and which one do you want to wear today? You go out to a restaurant and you don't give them the 15 drinks that the waitress gives you, but you say, do you want tea or water? You're still giving them some independence, but you're also lessening the behavior of getting frustrated because they don't know. If they look at a menu, they cannot find something to pick out. So sometimes it's a good idea to have something picked out before you get to the restaurant. The word why can become very frustrating for the caregiver. And so it's very important, again, everything that we've talked about, our approach, our tone of voice, our demeanor says everything. Use one direction at a time. I'm going to help you with your bath. I'm running warm water. Let me take off your shirt. So you're giving them one thing at a time. You're just not putting them in a scary situation. You have to tell them what you're doing so that they know what you're doing and that you're just not tearing off their shirt and they're thinking what's happening, or you're turning the water on and they're fearful of that. So you have to be very conscientious. Say exactly what you're doing at the time that you're doing it. And we, again, in closing, gently touch, smile, reassure your loved one. They may not be the same person they were 20 years ago, but they are the person that you love. And I tell my families, sometimes it becomes a love-hate relationship. You love the person they are, but you hate the life that this has given you both. And it's so important that we look at them still as that individual. We look at them as that person they were years ago, respect them, find a way to communicate with them, find a way to manage those behaviors and to find a way that's calming both for you as the caregiver and for your loved one with the diagnosis. Thank you.
Thank you, Jackie. I'm going to give everyone a chance to ask questions, and you can put that in the chat box, or you can let us know you have a question. I have a question for you, Jackie, something that came up yesterday. A gentleman called me. He was at Barnes & Noble, and he said, I was just at Costco. My wife jumped out of the car. She claims she doesn't know who I am, and she was running down 44127. And I was yelling, I'm the husband. I'm your husband. You remember me. I'm your husband. So he was hiding in Barnes and Nobles, trying to talk to me on the phone about we've got to look for placement. Sometimes, as much as you want to take them out or you want to go places, things can turn on a dime, right? And you mentioned not telling people, you know, this person has memory issues, but you could also, I mean, that was a really dangerous situation. And things can change in a restaurant when you're out. Do you have any suggestions for safety? That was, and again, I had another family this week called me. She had brought her husband to the hospital because he had a urinary tract infection. He ran out of the hospital. They had to have the police find him. It took 3 hours to find him. How do you, I know there's a lot of safety things that you talk about, you know, through the police and through tracking, but what do you think are some safety things people can put in place if they're taking their loved one out and things go south really fast?
Well, we have what we call companion cards, and we give them out to family members. And it basically states on there, my loved one has Alzheimer's. And, you know, if you're in the grocery store line or if you're in a restaurant and all of a sudden there's an outbreak, whether it's language or tone of voice or who are you, you know, what are we doing here? To be able to slip that card to whoever is waiting on you or the grocery store clerk or the people around you to indicate my loved one has Alzheimer's. You know, we talk about a lot of safety issues with, we have called what are called scent jars. And they allow you to get a complete DNA of your loved one. You're able to keep it for 5 to 7 years on top of the refrigerator. You're registered with the sheriff's department or the police department, so that they know if your loved one should get lost, that they're able to call in the dogs to be able to find your loved one in a fraction of the time of a search party. In this situation where she jumps out of the car, that's a real dangerous situation, to say the least. And it's one of those times that, again, she didn't recognize him as her husband. You know, you have to kind of look at your time of day. What is their best time of day? Is it in the morning? Is it the afternoon? You know, when is the best time to be able to take my loved one out if I choose to? Or maybe it's that time where now I need to have some assistance, a home health agency, or someone to be able to come in the home while I do these chores, while I do these things, so that doesn't happen. Because you know, you're assuming that maybe she's in her 80s, he's in his 80s, he can't run after her. You know, he's pulling the car off the side of the road, which becomes a huge danger situation in itself. So just finding that time of day that maybe is best to take them out. Maybe in the afternoon with sundowning, they don't know you as well, they don't recognize you. Sometimes it's, you know, there's second marriages in relationships.
Right.
They may be remembering their first husband, don't see their second husband as their husband, you know, but they're able to, you know, that's what maybe she's saying, you're not my husband, you're not my husband, because they have just completely spaced that time out in their life and they only recognize their first husband as their husband. So, you know, everyone is so different that we just really have to see what is their pattern. what are things that we can do to help them? I mean, safety is one of the biggest issues that our caregivers have in the home. They don't dare leave them at home alone. They're afraid they're going to walk out. I sleep with one eye open because I don't know what's going to happen. And so it becomes very hard for them to be able to cope with that. I can probably guarantee he won't be leaving the home with her again for any time soon. But it is at that time. I mean, again, we're back to the question, when is a good time for placement? And when it becomes these safety issues, then we have to not only be concerned for my loved one with the diagnosis, but I have to also be concerned for myself as a caregiver. How would I feel if something happened to my loved one? If they were hit by a car, if something happened, that because I was not able to keep an eye on it. We all know that our little ones can disappear in a matter of seconds, and so can the elderly. They are Houdinis, they're quick, and if they want to escape, they're going to escape. And for some reason, I mean, she had to go through a lot. She had to unbuckle her seatbelt. She had to open the door. I mean, this was something that she might have feared. I'm in a car with a stranger, and they're going to hurt me.
Right.
And so again, it's back to that finding out when is a good time to actually take them in public. And some families find they just can't. That's the same with family gatherings. You know, you can take them to a family gathering, but within a half an hour to an hour, they're ready to leave because they don't know anybody. Everybody looks different. And again, this lady in this situation wasn't seeing herself as she sees herself today. She wasn't seeing him as he was today. She was seeing someone in her life from the years past. And so that could be a very dangerous situation. So I just ask the families, find out what's a good time of day to take them. And you got to know that you can't take them out for 2 to 3 hours. It exhausts them. And so you really have to focus, okay, this is a 1 hour trip and we can do this, versus thinking, I want to go to Sam's, I want to go to Target, I've got to go to, Lowe's. That's not a time to do all that together. You've got to pick and choose your battles. You've got to pick and choose, what can I do safely and how long a time of a span I have. And everybody's different. Everybody's different. You got to know your loved one, and you got to be able to decide, what's good, what's not good for us.
I think, especially when you're caregiver burnout,
Yes.
you're looking for something to do, right? And shopping or going someplace is an activity. And sometimes you're not realistic.
Yeah.
Excuse me. Let's see. I think we have a question here. Oh. So what's the biggest takeaway that you'd like us to learn today, Jackie?
Well, again, I think because the caregiver is so important in this journey, that I want the caregiver to realize they've got to take care of themselves. They have to realize that this isn't something that we all have an instinct to be good at. We were good parents, but are we good caregivers? And we have to decide, what can I do to change that? I think, as I've said multiple times this morning, is stepping out of that world of reality. You cannot be in a world of reality and be a caregiver of someone who's on this journey with Alzheimer's once they are past the point of any communication, because it's not going to work. You have to pick your battles. You've got to step into their world of validating where they're at and being who they want you to be at that moment. It's going to save the caregiver a lot of frustration. It's going to be less frustrating for the loved one with the diagnosis. And sometimes, this happens early on in this journey. Other times it happens later on in this journey. So I hope everybody takes away that, it's okay. And it's okay to be frustrated. But we want to make sure how we choose our words, our tone of voice, the way we talk to our loved one plays a role in what my day as a caregiver is going to be. My day as a caregiver, what it's going to look like. And so it's very important that, again, don't try to bring them to your reality. Step outside the box. You're going to have to become creative, and you're going to have to become a part of their world and validate where they are. And your battles will seem less, and the caregiver will be less frustrated on this journey to be able to get through one more day. And that's what it is. It's one day at a time. And that's what's so important for our caregivers to understand. It's okay. We're going to have good days. We're going to have bad days. Cherish those good days and work up to those bad days. Get through them and hope the next day is better.
Yeah, recharge your batteries, have a plan, have backup plans, right? So if the day is going kind of sideways, what are you going to do? Or if, you know, again, you get sick, what's your plan? Make sure you got a plan for respite to recharge your batteries, right? So again, sometimes just the communication is tough, the day-to-day. Don't underestimate how hard this is for the caregiver. So have a
Absolutely.
plan to step away, either by family watching a loved one for a few hours, a neighbor, maybe a daycare program, even a week away so that you can go visit your family and the loved one is maybe in a memory care. Again, don't underestimate the caregiver needs a break every once in a while. So
Absolutely.
all right, so I think we have I think our last slide. So Jackie, if people want to get in touch with you, what is the way to get in touch with you?
Easiest way to get in touch with me is to call me on the phone number that's being listed there. That's my personal cell. And if I don't answer right away, because we all get different out-of-state phone numbers and spam calls and such, please leave me a voicemail and I will return the call to you. And if I can be of a service and encouragement, give you some direction, some reassurance. I had a family call this week saying, I just need to hear somebody say this is okay to do. And when I said it is okay to do, she just felt a sense of relief. So it's just, you know, I'm here for you. I've been in this business for 50 years. Since I was 16, I've worked in long-term care. And I love this generation. I love being an encouragement, a support, and a hand if you need a hand to hold.
Oh, that's great. Great to know that someone understands the journey and can be a resource and a cheerleader and support, and sometimes validating that maybe it is time for some resources to move forward, right? So thank you for everything you do, supporting the families, supporting the person with the memory loss. Because certainly we don't want the caregiver to end up upside down or sick because of the stress of this. So thank you
The
so much.
statistics show that 60% of caregivers pass away or get ill before the loved one with the diagnosis, and that's what we don't want to happen.
Right. Well, thank you so much. It was great hearing from you again. We look forward to your next presentation, your wealth of knowledge. Stay safe. And if anybody wants to get in touch with Jackie, her information will be on my website. So go ahead to Your Key to Senior Living Options, and you'll be able to find Jackie's information. Thank you again for all that you do. Take
Thank you.
care. Have a great day. Bye-bye.
Everybody too. Bye-bye.
Bye.